here with Christine and Sophie at White Hart Clinic in Barnes. We're going to talk to them about really difficult problems for some women possibly. We're talking about incontinence, prolapse and pelvic floor, and possibly other things as well that might crop up along the way. So
No doubt.
could you introduce yourself to us and tell us exactly what it is you do at the clinic?
Sure. Now, my name is Christine Bird. I'm really happy that Anne and Joe are here talking about a very important subject that's very close to our heart. And the reason we like to do these talks and talk to women on the whole is that often we keep really important public health messages behind doors, in the treatment room, and really we want to share those messages with everybody out there. So today we're going to talk about the pelvic floor muscles, which we treat on a daily basis, because it's a pretty important set of muscles, as it's responsible for bladder function, bowel function, better sex. So hopefully that's enough to start.
So hopefully we've kind of got your attention already.
I work very closely with Sophie, who I'm sure I'd like to introduce.
I'm Sophie, I'm a women's health physio and treat a lot of pregnant women, people after having babies, and sort of special interest in women's health and prolapse and incontinence.
Anne and I think we know about incontinence, but we definitely don't know as much as you guys.
Yes, exactly.
Christine can take it away, basically.
Yeah, sure.
You know,
I think what I'll start with is explaining what the pelvic floor
Yeah.
muscles are and where they are, and Sophie will. Sophie's got some different models and toys. At the moment I treat a lot of perimenopausal and postmenopausal women as well, and obviously I developed this interest while I was getting to the beautiful wise age myself. Amazing. Of course, continence issues and prolapse issues become much more prevalent when we're getting older. Perimenopausally, your hormones start to fluctuate.
Yeah.
Your vulva and vagina, and we are going to use those words
Yes,
on a
you're allowed
regular
to.
basis.
In a medical term.
Love estrogen.
Yeah.
So it's an area of your body that is very, very well what we call estrogenized. And obviously when your ovaries go into retirement and your estrogen levels drop, it really has an effect on your pelvic floor muscle functions. So all those important functions that we just talked about, like bowel, bladder and sex, obviously become much more challenging peri and postmenopausal.
such a joy, really, isn't it?
But the good news is there's a lot you can do about it.
Great.
And considering that we are one of the first generations, hopefully, touch wood, that will live 1/3 of our years beyond the menopause, the longevity of the pelvic
It's
floor
really
muscles and the support of your pelvic organs, incontinence obviously become much more relevant. So this is the way I'm sitting here. This is my pelvic floor. So the rectum is at the back. The uterus sits on top there. So this is the way I'm standing. This is the way I'm standing at the moment. Sophie's got a different model, so I'll show you at the moment. But I'm going to show you what's actually in the middle. This is something in a treatment we often scan as well with an ultrasound scan, so we can actually show to women what their pelvic floor muscles do, especially if they're not connecting up and they're not sure. So I'm just going to take 1/2 of that. So this is cut through to the middle. So it's the pubic bone at the front. Then you've got your bladder with your urethra. That's the pipe you wee through. The yellow part here is the front wall of the vagina, and especially Sophie will talk a lot about that later because that's so important in creating tension to support the bladder, the vagina itself. And this yellow bit is the back wall of the vagina, and again that's very important in terms of supporting the rectum. So your pelvic floor muscle on this model, it's like a line from your pubic bone to your tailbone. That's actually not quite the way it's in real life. It sits all V-shaped around all the structures to maintain continence and to provide support. Is there anything from your model you'd like to add to that?
So I guess just looking at the pelvic floor is muscles and connective tissue. It's not just the muscle, which I think is what we all hone in on a lot. But the superficial muscles are more your squeezing ones, so they control the rectal continence and then also through the front here. So they're more the squeezing muscles and the superficial pelvic floor. And then if you have a look inside the pelvis, you've got a layer that sweeps all the way up from the pubic bone at the front, all the way around to the coccyx, and it surrounds those organs. So again, that provides the lifting action, which is more where we've got some support through the organs. So there's 2 layers to the pelvic floor, and there's 2 important movements that the pelvic floor create, which help support the organs.
Fantastic.
Wow. Walk through the pelvic.
Yes, we've done our anatomy for the morning.
And obviously with weakening of the pelvic floor muscles, continent issues and pelvic organ position can change. This can be caused by childbirth, that's definitely one of the main risk factors, also constipation and being perimenopausal and menopausal. There's a lot of other risk factors as well, but those are probably the main.
Yeah, I think
main
just
risk
pregnancy
factors
itself
as well.
is a really big risk factor. A lot of people think that prolapse only happens if you've had a vaginal delivery, but it can happen with just having a pregnancy.
Oh, really? Yeah.
Depending on different sports that you're doing. You know, if you have lots of pressure coming down with certain exercise.
What is a prolapse exactly?
So prolapse is where the pelvic organs that tend to sit above and rest on top of the pelvic floor. So when we talk about pelvic floor, it literally is the floor of the pelvis. So it's holding everything inside that pelvis. So prolapse is when the organs start to descend down because of damage to the connective tissue or because of weak pelvic floor. So basically it's our prolapse chicken. So So it gives you an idea. I mean, if your pelvic floor is supported underneath and you have the organs sitting inside, if you're very weak here, your pelvic floor is not supporting as well as we'd like it to, or if there is damage to the ligaments or the connective tissue that support the pelvic floor, or if you have a lot of pressure coming down through the top of your abdominals, what can happen if I push through the top is you actually see something starts to come out. And that's basically what prolapse is the organs start to descend down into the pelvic cavity, and sometimes they can descend all the way out.
Not pleasant.
No,
it is a very common issue.
Common, but I bet lots of women don't talk about that. Like,
No.
you know, they don't talk about any continence issues. I think that's got to be a really difficult one for women to
Around
actually.
50% of menopausal women do have a level of prolapse.
Right, 50%.
It's huge.
But
Wow.
a lot that's why probably more alarming than it needs to be.
Yeah.
A lot of those are mild to moderate.
Yeah.
And if a prolapse is mild to moderate and you manage it well, you can really manage it, and you can manage it well for the rest of your life. But and that's why it's so important to get the message out there that women are aware of it. When they pick up on the symptoms, which Sophie will talk a little bit more about, that they go and ask for help.
Yeah.
There's a really good, helpful study actually that with continence and prolapse symptoms, women take up to 10 years on average to ask for help. And these are the women that do go to their GP to ask for help. And what that study showed is that women only ask for help is if the GP is female, looks interested, and is old enough.
Yes.
So
To understand.
that's right.
Yeah. So a young man is never going to be
Possibly
someone
not. That's right.
who's also quite attractive, probably too.
Yeah. And that's why it's really important if you go to your GP surgery to ask for a GP you feel comfortable with.
Yeah.
Maybe ask for a female GP if you prefer that. And if you see a GP that dismisses it or doesn't quite understand, make sure that you end up with the
And I
most-
think
the
sometimes
best GP
when
in
your
practice.
GP's receptionist say, "Can I ask what this is about?" and I always go, "No, you can't." But actually, what's been coming out of a lot of these conversations that we're having with people is that they are trying to get you the appointment with the right GP.
We all have to go for our smear tests, which women must have to do on a regular basis, whether or not they could talk to their nurse about it in the practice and then go via
I think that's
that
a really
way.
good idea.
Is
And
it
also the
something
nurse
that
will
has
know.
spot?
Some nurses might,
Yeah.
some nurses might not, but the nurses most certainly will know who is the GP in that practice,
Yeah.
who has more of an interest in women's
Yeah.
health or menopause or continence issue. Then maybe
There's
go see a
someone in the area,
gynecologist or
yeah.
a women's health physio in the
Don't
area,
be
or a
prepared.
Don't suffer in silence.
That's right,
basically.
exactly, because this problem is so common,
Yeah.
but it's never normal. And too many women think, oh, I've had a baby, I've been pregnant, it's normal that I leak, and they kind of might have a sort of giggle with their friends.
So the positive, the message that I think we've taken already is everybody can do something. So and it's never too late. So we are going to find out what you can do. So back to you.
Well, of course, the first thing is to do your pelvic floor muscle exercises.
One exercise that you'll be able to do.
Yeah.
So we're going to teach you today how to do an effective pelvic floor muscle contraction, but we also really want to make sure that if you're not sure how to do it, if you're not sure how to connect up, do go and ask for help. Or if you do already have symptoms like any leakage, when you cough and sneeze or trip over the dog or anything like that, always go and ask for
Or skip.
Or skip. Yeah, and there's a whole range of things, but always come, and same with bowel issues, always come and ask for help. So the pelvic floor muscles and how to do a best contraction. That's what we'll start with. So the best way to think of your pelvic floor muscles is to very much think what Sophie showed earlier. is the muscles around the back passage. They did a lovely study a couple of years ago when they put women in big MRIs, asked them to think about different things and see what happened to the pelvic floor. And actually what that showed up, that when women thought about the back passage more, and I'll explain in a moment how you do that, although you might have some ideas on it. That actually for most women created a very effective pelvic floor muscle exercise. A contraction. Doesn't always work. I mean, if it doesn't, we also test and retest and see what does work. But when women then start to think more of the front as well, it didn't actually add that much to the contraction. And I'm always a great believer in keeping things as simple as possible. So this is possibly most simple. It doesn't work for everybody. If it doesn't work for you, definitely come and see somebody. So imagine that you need to pass wind, and as it's just been Valentine's Day, it could just be that you're on this very important that's right, you're on this very important date, and it's just not the right moment to pass to do so. So imagine passing wind and holding on. So you hold on to your fart, basically. But
Hold on to your fart,
that's right. But then also, if the time is right, let go again. You think it might have disappeared, and then you might think, oh, actually, no.
It's not gone.
That's right. And the date is still going well.
It's not silent.
That's right. Hold on again. So I'm hoping that for most of you that connects up. Does that connect up? So the best way to start doing your pelvic floor muscles is by taking a gentle breath in. Then breathe out, because your pelvic floor comes up a little bit anyway, and then hold your fart and see if you can count until 10 while you keep breathing. Ideally you can count until 10, most women can't, and after 2 or 3 seconds it might start going down. It means that you need to build on your strength and endurance.
And it's important that you keep breathing rather than just
it's not
holding it.
Thing. Ideally people wouldn't see that you're doing them.
Yes. I do. I don't know why I tend to look upwards.
You're impressed right now, I just say. But something that you could do at the kitchen table, at your desk.
If you're well connected up.
Yes.
Yes, a lot of women struggle more than that, and they might need to lie down in a quiet room and make that connection. But if that's the case, you might actually need a proper assessment, internal assessment, to see what you're doing anyway. What is quite helpful, and if you're watching this from home and it's private, is to sit on your hand and feel your your vagina, and then you can feel, does the back, the middle, the front, can you feel it? Can you feel it lifting? And sometimes a bit of sensory feedback is
you can also have a look as well, and just if you're comfortable having a look with a mirror and just seeing if that perineal area actually lifts, and if you get that little squeeze through the anal sphincter at the back, depending on how comfortable you are having a look.
And you don't ever need to tell anyone.
But please don't send your videos in.
There's a great app, I'll just hold it in front of the camera, called Squeezies, developed within the NHS. If you haven't got it, download it today. So non-negotiable. Everybody download it. It has got some very helpful information on it as well. You can set it for, when you just download it, it will set itself for 2 or 3 times a day, 10 times 10 seconds for your long hauls, which is really important because your pelvic floor has to maintain continence and support you for 24 hours a day. So it needs those long distance marathon running muscles. It also needs your strength muscles. You also need to do some quick flicks. That's which you need when you suddenly cough and sneeze. And on the squeeze app, that's all integrated. Okay, so but we're hoping that from today onwards, for up to the rest of your life, whenever you cough and sneeze, you always hold your fart in.
Right.
Yeah, because when you cough and sneeze, you've got a lot of intra-abdominal pressure, which means that your pelvic floor muscles descend slightly. Okay. So it's something that we have more of a reflex.
So practice will make a perfect. You're going to be really self-conscious doing it initially. You're going to say, but then it'll become second nature.
Absolutely. And what's nice about the squeeze as well, that you have a little drop that goes up, but also a little drop that goes down. And the releases are just as important, because it's all about control. It's not about brute strength and holding up. Okay, ladies, squeeze it up, but all again goes up needs to go down, so you relax afterwards as well.
Just make sure you don't use your tummy too much, because again, as we showed with the prolapse chickens, if your tummy is using too much force, or you're trying so hard that you're pushing, it's actually going to have the opposite effect. So we want to be lifting and drawing in, not pushing down.
Especially, I mean, if you're sort of not always entirely happy with your tummy, we spend a lot of time telling our patients beautifully around the belly. If that's your normal shape, good posture is good, but don't suck your tummy muscles in. So your normal shape. A
Yes,
lot of
that's
females
something
have
I
a
liked hearing from you
Yeah,
guys. It's
beautifully
good to
round
have
belly.
that.
Not many women have an absolute straight six-pack anatomically.
No.
There are a few that say, but most of us have a beautifully slightly rounded belly, and that's the normal shape.
Right.
But that doesn't mean that you can't be strong and that you
Yeah.
can't have good posture. We just know.
We're all just sitting up straight.
Because
We've been very good.
Because we think
Good posture is actually very efficient. It's all about efficiency. So
Yeah.
if you're making a massive effort, it probably isn't good posture,
Yeah.
and you're not going to hold it all day.
No.
So just sit comfortably, efficiently, move around a lot, and that generally is what matters. What matters there the most. So squeeze the ab.
Squeezy up.
Okay. Is this a good moment to talk a little bit about prolapse?
I think so.
Yeah,
Yes.
definitely.
So basically prolapse is where the organs descend down through the pelvic cavity, so they're not sitting in their high position and they do start to descend down. Sometimes the organs can come outside of the vagina, there's sort of, prolapse is like a stage system. It can be about a little bit of movement, or it can be to the point where the organ actually physically descends out of the vagina. So even though you may not be able to see anything, you still may have a prolapse. And I think that's really important, is some women don't know they have it and aren't aware of the symptoms to even ask for help and know.
You know the next question, don't you?
Yeah. So the symptoms of prolapse. So it can be anything from a bulge at the vagina, or when you go to wipe afterwards, feeling something hard there. But most women describe it as a feeling of something falling out, and that heavy, draggy feeling, possibly after being on your feet, worse at the end of the day. It can also be a bit of lower back pain. So because of where the organ's then attached through ligaments up into the pelvis and into the spine, you actually do have some attachments there. So if those ligaments are pulling and stretching, some women will actually describe a sort of nagging lower back pain, again following the patterns of worse at the end of the day, not getting better with normal treatment. They may have seen a few different physios, but if it's not fully addressed in terms of why they're getting that, it can be linked to prolapse. Prolapse can also cause incontinence. So some women who cough and sneeze and may have a really, really good, strong pelvic floor, and that's not the reason for their incontinence. If their bladder has tilted slightly, it just changes the mechanics and how the organs are working. So generally a heaviness or a feeling like something's going to drop out are the main things people talk about.
Yeah.
Is it painful?
Some people say yes, it depends. I mean, again, it really depends. If the organ is protruding out, it can rub on sort of your knickers and sort of give a chafing type feeling. So in those cases, obviously there's an infection risk if you do develop sort of a chafe or an open wound. So some women do describe it as pain, other people it's just more of a discomfort and that sort of uneasy feeling.
Yeah, so if somebody came to you who thought they had a prolapse or does have a prolapse, how do you treat them? What are the options that they have?
So initially we'll always do an assessment and we'll try and take a few different measures and work out their risk factor. There are a lot of risk factors for prolapse, again, pregnancy, vaginal delivery, but it's not exclusive to vaginal delivery. Also women with cesareans or people who've never had a baby can also have prolapse. Again, it depends on the type of delivery you had. With a vaginal delivery, really big babies, big head, or a long pushing stage, forceps deliveries. There are things that generally we start to get a picture of, oh, this could be more likely that you're going to have a prolapse. So initially we just take an assessment, we see how bad it is, check the pelvic floor, and if there is weakness in the pelvic floor, then the first thing we do try is managing pelvic floor contractions. So trying to get some strength there to support the organs upwards. I think one of the other main things we look at is what else you're doing lifestyle wise, and things like certain type of exercises we might just pull you back off. So high impact exercise initially might be something that we either modify or give you supports. When I talk about supports, there are different things. So there are pessaries, and these are not the only types of pessaries, but I'll just show you a couple. So
God, I thought that was one big one. then.
no.
That's quite big.
So basically a pessary is an internal support to hold the organs up. So it's like a space occupying object, something that just blocks the space so that an organ can't descend. So there are different shapes and sizes. These are our ring pessaries, and again this is sort of one of the smaller ones, and you can see that they go right up to a really large one. So it depends on the extent of your prolapse and how big the space is that we need to support. There are other types of pessaries. I don't know if you can see this one very well, but this is a cube pessary, so it does have suction and more support. So there's different pessaries depending on the type of prolapse.
So that cube one, do you have to put it in and take it out on a daily basis? Or?
Yeah, so the cube does actually involve a little bit more management because it has suction. When the pessary does sit in and up, your front wall of the vagina suctions here, the uterus at the top, and then the back wall at the back. So it does suck up and hold, so it blocks everything from moving. So because of the suction, we do need to manage this one a little bit more. So it does need to come in and out to allow the tissue to then breathe, so you're not at risk of...
Is it personal preference, or is it depending on what you've got going on, that you would have one or the other?
Yeah, so the ring pessaries are great if you have enough baseline strength and support to hold them. But if you're really weak, or you've had quite significant trauma to the pelvic floor during delivery, or you have quite a wide space, sometimes the rings won't work and then will just come out. Or again, depending on what you're doing, if you're doing high impact exercise, or if you have a really bad cough and you've got this constant pressure down, the ring may not be enough support. And that's where we might try a cube or a different type of pessary.
That's why it's so important to get a proper fitting. Yeah. Somebody like Sophie who specialises in fitting, some gynecologists do, or most, or practice nurses, or some GPs, not many, but make sure that you end up having a pessary fitting with somebody who really understands.
About a third of women though won't find a pessary that does support them or that is comfortable enough that they can manage, and there are other things on the market, and this is something that's relatively new. It's actually a seed sponge and it's been completely sterilised. It's squishy, but it is quite firm, and again it's purely a space occupying object, so it sits up into the vagina and just blocks the organs from moving.
Does it feel a bit like a Tampax? Like, I'm just
yeah, it's probably like a more supportive, bigger tampon. There is a study going on with this at the moment, so it'll be interesting to see.
But it's a more natural product.
It's a more natural product, which again can actually turn some people off, because the idea of putting a sponge inside. Yeah, there are lots of things that you can use and try to support your prolapse if pelvic floor exercises alone haven't helped. But there are a lot of other things that are really important with prolapse.
It's not that you would pick which would be
we would decide which would work.
Practitioner would say for your
depending on
situation,
where the prolapse is. You have to be quite dexterous, and if you have something that's suctioned up high onto the organs and you just tug it, there is a risk also that you can pull. So I mean, it depends on the type of pessary and the person and personal preference, because sometimes the pessary might support, but you're not willing to manage that every day. And there are other things that are really important in managing prolapse. So constipation is a huge one, because again you've got a weight basically. If you have a really full rectum and it's sitting on the pelvic floor, it's just like a weight basically for your pelvic floor.
And then
add to that if you're then straining and you're pushing, it's that same thing.
Can be a big issue for menopause women. Another estrogen treat that comes their way. So
actually it might be quite a good moment just to talk about topical estrogen. Estrogen really supports the pelvic floor and pelvic health, and estrogen is very supportive in terms of muscle function as well. I personally recommend to all menopausal women to use topical local estrogen. There are no risk. It can be a cream, it can be a little tablet you pop into your vagina twice a week, initially every day for 2 weeks, and it really can make a big difference. So this is
and you can take that in addition to if you've got a patch or you're using HRT or a gel.
Like I said in the beginning, the vaginal tissue is such well estrogenized tissue. It's really important to have an additional.
So it's not something you would have to go to your GP to be prescribed.
That's right. It's licensed for perimenopausal and postmenopausal women in this country. It's inexpensive and is available to everybody.
I think
that's really information.
And is there a time limit? Can you take it for a year, or you say
really good question, because of course HRT is all about when do you start. Start early enough. There seems to be a window of opportunity, and that's really important because you want to maintain vaginal health. I think I can't see. There's no science. There's no reason why you couldn't take this indefinitely. Continue to use it.
God, that's amazing.
And what is that like?
It's a tiny little just shoots off.
And that's a tablet.
It's a tablet, but it can be a topical gel.
And that's something that women could go to their GP and ask for a prescription for, a repeat prescription, I'm guessing.
Yeah. So when we're talking about vaginal atrophy, basically what that means is a weakening and a thinning of the muscles, because there's less lubrication and less estrogen in that area. And it can make such a big difference for Prolapse symptoms, for continence symptoms, it's a simple thing to do. And vaginal atrophy is miserable.
Yeah.
It's itchy. You can't wear your favorite jeans anymore. It's unpleasant. Sex can be painful. That's right. So
Pessaries also sometimes won't work. So sometimes you may have bleeding or irritation from using a pessary, in which case we may, if you're at that age, send you to the GP to look for maybe some vaginal estrogen because it can bulk the tissue and
Okay, so that's our second absolute must-have thing. So we've got a squeezy out and we've got topical estrogen.
Yeah, absolutely. And go and see a specialist if all of those things don't work for you personally. And because we believe, I mean, ideally, I think for the three stages in life, or sort of productive, non-productive years or productive year, and menopausal years, women really could do with an MOT, women's health MOT from that country.
Which is something we don't have.
just an annual check, like you go to the doctor and you go through, you know, just do all your bloods and do everything else. It's the same with women's health. If you have an annual check, we can pick things up faster and manage them before they become an issue.
I think the pessaries are a really good example of that. They used to be often used for all the women that couldn't have surgery, and now we're using them much more as a preventative measure, often the first line of treatment, and also with a much younger and active population, and also the not so young and active population, because all of us now have much higher expectations of wanting to exercise, do things, which is a great thing, and actually there's so much benefit.
And actually women will not exercise if they think this is unpleasant.
And then they put on weight, and then their issues get worse.
So really this whole goodie bag, range of tables, conveyor belt of loveliness is saying that women have a lot of options before they have to go down a surgical route, and that
and what steps, you know, if they're exercising, and it can improve it. So it can improve their incontinence, it can improve
their prolapse symptoms. So if you sort of look at the studies, so 85% of women do very well with personalized, individualized pelvic floor retraining, which is not just about muscles like Sophie said earlier. It's the whole thing. It could be managing constipation, it could be about bladder retraining, it can be pelvic floor muscle retraining, but that really needs an assessment, find out what the key driver is in terms of the symptoms, and then start working with that. But we do a whole range of
so
lifestyle strategies.
So if women think that they have got a problem, what's the best way for them to go about dealing with it? Is it probably
go and see a GP, or maybe a practice nurse that you can talk to. Women's health physiotherapists, luckily enough, are now we've got a much better spread of people around in the NHS and privately. Again, go and find out what your local services are.
Do you get referrals to you from GPs?
Yeah, lots of referrals to GPs, from gynecologists, and also lots of self-referrals. Never too late to have.
So positive and so smiley, because it's such a sensitive,
so important,
intimate. It's a really big issue, and I think it's definitely the more we delve into the menopause, it's just overwhelming what women are living with. So I think what we can take away from today, it's been brilliant. Favourite prop, I'm going to be honest, is the chicken. The app is fantastic. The tip for estrogen, and the fact that you can get referrals to women's physios via the NHS or down the private route. So
thank you very much.
Thank you so much.
Thank you.
Thank you. Bye.